Picture this. The journey ahead starts here together, and together we can build a brighter future. You are listening to Illuminating Hope, a podcast of Hope House. As President and CEO of Health Forward Foundation, Qiana Thomason guides the 1 Billion Foundation in stewarding diverse capital investments, leadership in public policy, and institutional social capital that fosters health and economic equity throughout Missouri and Kansas. Qiana's leadership has positioned Health Forward as a national model for health equity through trust-based public, private, and philanthropic partnerships spanning resident and faith leaders, grassroots to nonprofits, Chamber of Commerce and business councils, municipal and state government. Qiana draws from over 20 years of leadership at the intersections of health and behavioral health care, corporate health care payments, health policy, health philanthropy, and business. This aerial command of the political, private market, and social factors that shape health uniquely positions Qiana to impact the well-being and prosperity of communities. Qiana, welcome to the Illuminating Hope podcast. We're so glad you're here.
Thank you so much. I'm so pleased to be here. We have been doing a series on health, and our focus has been health around how that impacts domestic violence survivors, but it often goes into other areas as well. But we have focused on physical health, mental health, substance abuse. So I'm really excited to talk about this aspect, the disparities and the inequities in health. We touched on it a little bit with one of our former guests, but I'm really excited to spend some time talking about that because I don't think that we do enough of that. I don't think we really pay enough attention to that as a society, which I often think there's a lot of things about domestic violence we don't focus on enough. So I'm hoping that you could share first a little bit about you, how you came to Health Forward, and then maybe just what you guys are working on.
Certainly. Again, thank you so much for having me. So I would characterize myself, I call them my superpowers, as an advocate, probably a heavy dose of courage and leadership. Those are kind of my core superpowers, and I'm currently employing those as the president and CEO of Health Forward Foundation. I have a 25-year career in health and how health happens across the health ecosystem broadly. So that includes grassroots work around mental health parity and reducing the stigma associated with behavioral health and mental health in communities of color in Wyandotte County, Kansas, as well as focusing on child welfare in Wyandotte County as well, spanning to the United States Senate, where I was the Deputy Director of Health and Human Services for former U.S. Senator and the late U.S. Senator Jean Carnahan. Mm-hmm. So it was a really wonderful stint doing that work, the ability to bridge policy in a translational way to community. It was a beautiful work that I really enjoyed. Also, mental health work in our safety net system at one of our federally qualified health centers, or FQHCs, here in Kansas City, Swope Health. I started and scaled mental health court for Kansas City and scaled that to several jurisdictions, Jackson County, Lake Summit, Raytown, and others. And I love that work because it really interrupted disparities that exist for people experiencing everyday mental health challenges, as well as the severe and persistently mentally ill community members, and focused on treatment as opposed to through diversion as opposed to sentencing. And led that work, and eventually the entire behavioral health department at SWOPE took a leap of faith and tried my hand at the corporate side of things and did that for 8 years at Blue Cross and Blue Shield of Kansas City, focusing on population health. And so bridging that proximity to community and that nonprofit administration to healthcare payment was, man, I learned so much in that role.
Oh, I bet you learned so much in that role.
And how to improve the health of populations and communities through equity-centered payment innovations and some traditional care at health plans, the care world. And now I'm in health philanthropy, and so I have a very broad and aerial view of health and how health happens and how it's shaped, which is perfect for philanthropy because at Health Forward we work at all levels. We are a big tent organization, and on any given day we are engaging with resident leaders, which I did in my grassroots work back in the day, all the way to governor's offices, chambers of commerce, business councils, and of course our core stakeholder group is you all, our nonprofit partners. And so, big arc at Health Forward, we center people of color and we center rural communities because of both structural racism and structural urbanism.
I will would just like to say that I knew some of your background, but I didn't know all of that. But it just feels like all of that prepared you for this role that you're in, because you really are going to be able, or probably already have, drawn on all of those experiences in this work. I think that's fascinating.
Absolutely. I think
awesome.
life generally builds on the past, right?
It so
and
much
so
so
if we
does.
can just trust it in the process,
Right.
to know that it's leading us to an end. So yes, I've enjoyed the journey and am loving this current role. And I should probably say more about Health Forward generally before we jump in. So Health Forward is an independent, purpose-led public foundation. We center health equity as our North Star and focus on two factors that undergird health the most: racial equity and economic justice. So if you peel all the layers back of the onion, it usually goes back to those two factors in terms of the root cause ills of poor health or what shapes optimal health. And philanthropy is purposed to focus on those root cause factors. And so it's the nexus of our work. And so we focus on health and wealth building and center things in our work that creates and fosters both of those outcomes.
What are some of the biggest disparities or root problems that you're seeing today?
Well, they are vast. Of course, lack of coverage and access to health care. So Medicaid expansion is one of the key areas that we focused on for many years in both Missouri and Kansas. We see vast disparities, not just with people of color in rural communities, but people of all identities who are of low and moderate income and lower assets across our two states. And so we continue to protect that in Missouri and continue to fight for its passage in Kansas. I'd also say birth inequity. You've probably been under a rock if you're in health and you haven't heard about the maternal health crisis that we're experiencing as a country.
Yes.
Mm-hmm. Most countries use maternal health and infant health outcomes as top-line indicators for health of a country. And the U.S. has the worst health outcomes compared to our peer countries. And so at a national level, that's 22,000 deaths per 1,000 births. In Missouri, the rate of maternal mortality is 32.
Wow.
32 deaths per 1,000 births. And within that, Black women particularly are 2 to 3 times higher rates of mortality than our white counterparts. And when you look at all the causal factors or the correlations, there we see many things. Certainly racism in clinical space, disbelief in clinical space of Black women's voices. But we also see the weathering that has occurred in Black women's bodies and Black people's bodies due to years of toxic stress, and that accounting for a vast amount of disparities. And so the factors for that are broad. I won't attempt to go in that and unpack that particular issue, but that's one that we are focused on right now through some work that I can talk about later. There are elements of health disparities, which I prefer to say health injustices. I think it's more descriptive and animates what's really happening here and centers humanity. These are not numbers, these are people's lives.
Right.
And so there are other health injustices that we don't think about, like injustices in access and participation and democracy, right? Mm-hmm. Civic engagement is an influencer of health. The American Medical Association came out a few years ago and declared that. And so we know that voting communities, civically engaged communities, are healthier communities because they're paying attention to school board elections and to how our urban planning is occurring and all the way up the chain to national levels. Well, in Missouri, we have a disparity on eligible registered voters. If you just look at the Black-white disparity, only 47% of eligible Black individuals are registered to vote, compared to 81% of white eligible voters who are registered to vote. That's a vast disparity.
Oh, it's huge.
It's huge. So some of our work in our purpose plan, which I'm sure we'll talk about, centers around that health injustice. Mm-hmm. Also, home ownership. So remember, we focus on health and wealth building. Home ownership has always been and will always likely be one of the number one pathways to wealth building for a family. And so we see big disparities between Black and Latino and white households in our community that mimic the nation. And so I could go on and on and on.
Yeah.
I did not talk about some of the more obvious ones that we hear all the time, like diabetes and all those other things, because our view of health is broad in what shapes health. And so it's important that we look at other factors outside of health care to understand how health is shaped. And so that's why we focus on on addressing the injustices in other areas like place keeping, our neighborhoods, and democracy, and all those other types of things.
Right. I'm sure you've probably also gotten into like adverse childhood experiences and those kinds of, which is what we normally think of when we're thinking of health. And I think that's what I appreciate and want to spend some time talking about, is that broader view of health, because I do think that we have talked a lot about the things that impact survivors. And you talked a little bit about the maternal health. And, pregnancy for survivors is a very dangerous time. So we think about it in that aspect, but then when you peel away those other layers, it's even more complex than just what's impacting survivors. So I think it's really important that we have this conversation and that people really be able to be open to the idea that health isn't just about your physical health. I think even just the conversations we've had recently as a society around mental health, we're talking about mental health so much more than we ever used to. I mean, even just within our area around domestic violence, it used to be a taboo subject. We wouldn't, oh no, you can't say that because people will think that you're saying that a survivor's crazy. No, that's not what we're saying. We're not saying that at all. So I appreciate the opportunity to talk about those wider views. And it's also very timely with, we just had an election both at the state and the national level that will have an impact on us no matter which side of the fence that you're on. And we're a very divided country. And I do believe that that has had a huge impact on us, the level of stress, the level of anxiety. No matter what your viewpoint is, there's this level of tension that I think we have to really talk about. And who's participating in those conversations, I think, is really important too. Who's having a say and where we're going to go, what we're going to do as a state and as a country. So.
That's right. And I think that's why, to your point of who's having a say, that really matters, because equity cannot be achieved unless you are centering someone. It's a hard concept for some people to grasp in terms of, why do we have to center Black and brown, or why do we have to center rural, which are the communities we center. We often harken back to the analogy of curb cuts to help people understand equity and the importance of centering. So those are those little cutouts in our sidewalks that we use for luggage and shopping carts and strollers, but they were originally created for Americans with disabilities because of the Americans with Disabilities Act. They were centered, people with disabilities, diverse abilities, but we all benefit. Same with use of our text messaging. Everybody uses that. It's the way of the world to communicate, almost more than a phone call or an email. That was developed for the hearing impaired. The hearing impaired was centered, but we're all benefited. And so at Health Forward, we center people of color because of both historical and contemporary harms that have caused vast differences and inequities in social mobility and economic mobility outcomes, as well as rural communities, because much of our world is now centered around urban centers. Payment systems and healthcare, population-based payments, our tax system, right, how much population you have, and so that is structurally disadvantaging our rural communities. And so we center those communities, and so to your point, who gets included, whose voices are most important? We believe it's those who have been most harmed by these structural factors.
How do you get people to have that conversation? Because I have found myself being very frustrated with having conversations that try to expand the thinking when I find people aren't really wanting to listen or hear that. How are you being effective? Because I think you are. I think you're being very effective. So what have you done, or how are you doing that maybe we could all learn from, so that we could also then not only do it ourselves, but be able to have more people at the table?
Sure. Well, first, health equity, racial equity is a practice. Just like healthcare, doctors and nurses are practicing, we are practicing health and racial equity because racism has infected and affected all of us. And so sometimes we get it right and sometimes we get it wrong. But I think one of the most important things that we often leapfrog over in health equity work is establishing a common understanding of the problem with common language. And sometimes the process of achieving that understanding of the problem and language can be intellectually jarring and challenging and emotionally challenging for people to grapple with. But that grappling in a safe and courageous space is really, really important. So taking folks back, just focusing on inequities for people of color, helping them understand not just the period of enslavement and all the harms and evil from that, but just these notions of extraction and systemic oppression, right? So when we think about why health injustices exist, we can track that back to extraction and systemic oppression. And so extraction of people from their native land, our indigenous communities, extraction of the enslaved to bring them here, extraction of labor from American descendants of the enslaved who built and scaled disproportionately held wealth in our country, and then were systemically barred from accessing those wealth building opportunities through policy, right? Through policies. And so when we develop that common understanding, we have to think about, okay, how does race even exist? It's a social construct that was developed to colonize wealth in our country and on the backs of enslaved people and their descendants. When we look at the arc of those policies, we're looking at of course, the era of enslavement, the Reconstruction era, the Jim Crow era, all the way through movements to redress those through the Civil Rights Act. But that didn't go into effect until 1968. We have people who are still living, right? My mom was born in 1954. Right? So we are not far gone at all from us just beginning to redress those issues. And when you think about the social policies that were really the original affirmative action policies that went in place to systemically advantage our white citizens over our black, like the Homestead Act that gave land for our white citizens to build wealth that African Americans and other people of color were not eligible to receive. The GI Bill, which had vast disparities in who got that GI Bill, which allowed folks returning from the war and our veterans to build homes and send their kids to college. That created this chasm of wealth that our black soldiers did not receive. We have redlining policies. Read The Color of Law. It can give you all that history. So I think allowing time and space to sit with that, to talk through that. Many of these things people don't understand or even know. Right? Affirmative action didn't start with African Americans or people of color. It started with our white citizens in terms of these social programs and policies that benefited them. And so sitting with that to understand the root cause, which is often economic, built on the racial hierarchy of these issues, is so important. And then sitting with how our rural communities and even white poverty exist. It's arguable that white poverty, which is so much more significant than black and brown poverty in our country, but it's not talked about. That's not the narrative, but it's so much more significant. It's arguable that white poverty exists so strongly because of the racial hierarchy, people voting against their self-interest. So, we have to really sit with these things, and these are decisions that we make that are shaped by narrative, the important work of narrative in this work, and that are codified through policies. And so our work has a very long answer to your question.
A good one, though.
Yeah, I'm processing.
Yeah, our work focuses on systems change, getting to the root of these inequities, ensuring that people of color and people in rural communities have access to capital and resources and economic opportunities and health building opportunities, ensuring that our policies and the arc of our policies are addressing opportunities for health justice at both municipal, county, and state level, and ensuring that our communications and our platform is bridging the divide between the people of color, the white, the black, white, and helping people understand that while they have vastly different roots and vastly different experiences, the outcomes of rural poverty, which in Missouri and Kansas is largely white, not exclusively, but largely, and the outcomes of people of color are very similar, very similar. And so I think we start at shared values, and then we say, what's got in the way of us all being able to benefit from what's important to our families? Most of us share those same values. And so then we can have the historical conversation and bridge it to today. That's the approach that we try to take, and we have a vast constituency at Health Forward. We're in a very blue city serving two deeply red states, and so everyone's health is important, and we center people in that process, and helping people understand the why behind that is core to our work.
Have you found success in that? What you're asking can be really uncomfortable. I know that as a white individual, sitting with that can just stir up all sorts of oh my gosh, stuff that you knew or maybe you didn't know. Are people open to that? Have you found success in that?
I think people are broadly stratified across the spectrum, a hunger and thirst for wanting to understand, wanting to be a better ally, wanting to be a better accomplice in building the equitable systems that we need, to I'm afraid to even have the conversation. Where do I begin? I don't want to say the wrong thing. Teach me, I want to sit at your feet. And it's yeah, we can talk, but you got to do your own learning too. All the way through what are you talking about? This stuff doesn't exist, right? So the full spectrum. And so what we often focus on at Health Forward is the movable middle.
Oh, I like that.
I do too.
The movable middle. Because we can't change hearts and minds of people who don't want it to change. We don't have any fairy dust or prayer oil. I have some personally.
Right.
There's no magic there. So we focus on the movable middle. People who are open to reason,
right.
open to truth, open to equity. And when you think about what justice requires, it's all of those necessary ingredients. Mm-hmm. Truth, some might even say righteousness in addition to equity, that the fairness, right? And reasonable people are malleable.
Yes, I agree with that. And I think that reasonable people, they bring this curiosity to the table. I was in a few meetings in Kansas City when Casey Common Good was putting on some violent crime meetings. And I did not know, and I was raised in Philadelphia, but I did not know that there was a red line district. I didn't know what that was until this year. And I thought, oh, that's a part of history I knew nothing about and wanted to kind of learn a little bit more. But spinning this back to healthcare, I really like what you said. Really, the comorbidities don't mean a whole lot when there's a lot of stress, when basic needs are not met. Somebody's not going to think about going to the dentist. Somebody's not going to think about going to have some kind of annual physical or labs. So I really appreciate the whole mission that it's centric around making sure basic needs are met so that we can now delve into other things. What are a few examples that maybe you know of? What were some disparities that you experienced yourself and that you know that some young Black girls are experiencing today?
Wow, you're taking me back. I think that everything that I have already described existed, and I saw it every day in my environment. And I also think that, so a few things that I can reflect on. We lived in the urban core, 3rd District of Kansas City, Central City. And because of inequities in education, my mother sacrificially chose to take us all the way from 28th and Paseo to 103rd Street every day.
Wow.
To the Center School District. And eventually we caught the bus or could drive. And initially it wasn't legit because she did what she had to do. But then because she's committed to being a law-abiding citizen, she got a studio apartment that did not have furniture, and we did our homework on the floor of that unfurnished studio apartment just so that we can get a better education in another school district that was miles and miles away from our home. That's an inequity that shaped my life. And everyone did not have that opportunity, that access, that mama who's going to figure it out no matter what because she wanted better for her babies. And so that for sure, inequities in education. I would also say colorism. As a young Black girl, I was of the darker complexion. And colorism exists in every community, in every ethnic identity who experienced colonization by Europeans. Exists in India, exists in South Asia, a lot of places, and certainly America. And so the darker complexion, colorism because of that. Also, the assault on women's image is not a new thing. The daily messages and assault to be Black and a woman was something that I was insulated and fortified against through my mother and my grandmother, who spoke life into me often and never let me forget who I was and never let me be disconnected from my power. But again, everyone doesn't have that level of deposits. I also, not in my household, I also remember seeing abuse of girlfriends who were in abusive relationships that were all throughout my school, all throughout my neighborhood, friends who had domestic violence in their home on a regular basis. And so all of those things begin to construct a reality that you have to actively work to disrupt default settings in your mind to say, no, this won't be my story. This doesn't have to be my community story. And how can I be a tool and influential in that process? Earlier I spoke about weathering, and many people often go straight to the health injustices that exist in Black and brown communities because of food, and food is a huge thing. Health behaviors are important, but we leap over the allostatic load that Black and brown people carry. How much higher was my mother's allostatic load than her white counterpart? How much higher was my allostatic load? All of those things affect our bodies. The stress, the cortisol breeds inflammation. The inflammation breeds chronic disease. We don't talk about that.
And you're absolutely right about that, 100%.
We just say, well, everybody's eating fried chicken. Everybody? Actually, the fastest growing demographic of vegans are Black Americans.
Right.
So now let's think about what's happening in our bodies and epigenetically in terms of how we're passing that down in terms of the toxic stress to our babies. Right. And when I think about survivors who you all focus on every day, that toxic stress is a real thing. It is a real thing in the bodies of the people that you support and their children and what is happening. And so when we think about the injustices in health, we have to take a whole person approach. Mind, body, behaviors, dental, oral care, and spirit. One of the primary access points for women who have a higher allostatic load because of trauma and abuse, you see every day.
That's been going through my head as we've been talking, is that all of this, I think about the people that we work with and all of the things that they experience, and then you add the other layer on top of that. So when we talk about it, we don't necessarily bring up the racial injustices. And I think I definitely want to be thinking about that as we go forward and how we're talking about it. But all of these things are what survivors go through. And then you're just adding that extra layer on top of it. So the burden already felt so heavy. I'm just imagining, really just feel it in my body as you add that extra on top of it. So I really appreciate that part of the conversation. Just helps me to think about how then do we need to be speaking as we go forward as well.
You talked about so much of the ecosystems and the surroundings. What kind of place does someone live in? What are their surroundings? What do they have to do to even get to work? What kind of barriers are there? There's so many, and I think that so aligns with a Hope House mission as well.
The conversations around just everyday living, what you have to do to survive, and then you add those extra pieces on top of it. And we had a conversation, I know you know Jessica McClellan. She's been one of our guests. She talked about her grandfather and the whole history around the education piece with them and the busing, and again, just thinking about how that is so pervasive. I really appreciate that we're starting to talk about it, because those are parts of our history that a lot of people don't know anything about.
That's right.
Yeah.
And it's so important, especially in safe havens like you have here at Hope House. It's important that women and people, realizing all survivors are not women, are able to bring their full selves to this place, no matter what their identity is, ethnic identity and so many other intersectional identities. I do think that it's important to broaden the realm of understanding about how health happens with these survivors is really important, and the mental toll, all the different factors related to race and ethnicity and income and neighborhoods, all of those factors they're bringing with them, and space to unpack that, learn about it, skill up staff, just like we've had to do with Health Forward.
Oh, 100%.
Equity is a practice.
Yes.
None of us come here knowing how to build equitable systems when all we've seen is inequitable systems.
Exactly.
Right,
Exactly.
right.
We have to learn how to do that. We have to learn the language of equity, to learn what things mean. We have to learn how not to do harm in our language. We have to learn the importance of a narrative, the importance of whole self space for people to be able to have transparent conversations about their experience, which can be vastly different from someone else's, about what they need to be well, which may be more or less than somebody else's, and that's okay, right? And so that's where equity lies.
Right. We spend a lot of time with our staff around our goal is we accept people where they are, and that we start with them there. We don't try to make them into something or someone that they aren't. But it also, as we've had this conversation, then my mind is also thinking about, okay, what more can we do in training of our staff so that they are able to truly accept someone where they are if they're bringing something they don't understand, that's new to them, that maybe scares them, that maybe goes, I don't understand this. So again, I think that's good for us to be able to say, okay, what next level of training could we be doing? And we have therapists, we have case managers, we have court advocates, so we have this wide variety of people. I think probably of all our staff, our therapists get the most training that's geared towards some of those things because that's what they do. But I think that's a challenge then for us. Our goal, and I always say that we take people where they are, but when they're coming with these layers that you've never even thought of before, how are we truly doing that?
Mm-hmm. I'm so glad you referenced that in terms of training, because it's something that as equity practitioners we have to get serious about and invest in, and not see it as a check the box if we're wanting to really impact lives and help folks thrive. At Health Forward, as we've pursued our equity journey, we started at a very foundational level just with building trust within the organization. Like, let's not even talk about about equity, structural racism, health injustices. Let's talk about trust, because if we don't have trust in the organization, there's no way that we can do this lofty work.
There is no way you can.
There's no way. So we started there just with working to become a high trust culture. Several steps forward, a few steps back along the way, leapfrog then, and a few steps back. That's how it goes. But organizational trust, interpersonal trust was really an important foundation. And so we learned the behaviors of trust with one another. Then we began to talk about all the different realms of establishing the common understanding of the problem around racial equity and economic injustice, and began to learn and are still learning around what that means and how we practice it, how every policy, every decision that we make has an equity implication, and helping our staff build the muscle to detect it and to seek it out in the decisions that we make and the policies that we're advocating for. So the arc of organizational work and internal policy and practice all the way to macro level systems change. And so we have to tool ourselves to practice this. It is not an automatic, and it doesn't come from a good heart. It can start there, but a good heart is not sufficient.
No, it's not, that is not enough.
You really are talking about the intention, and the intentions can be good, but you have to put something in with the intention. I like that you talk about practice, because that means that you're continually doing it. It's not just, I have this great idea and then we just leave it there, but we're working on it on a regular daily basis.
Absolutely.
So.
And being intentional also helps to promote that equity, because you're having somebody coming from a system to go to a system. Maybe they'll come to us in a system, and then what we want to do then is empower them to become more independent and give them more opportunities maybe that they didn't have before. And I feel like that's how you build equity. So if somebody just left here and went back into another system, I don't know that we're doing a whole lot of good.
Hopefully we're giving them something to take with them, that it may not be all that they need.
Yeah, may not be all. That could be impossible.
Well, I think we have to live with that every day.
That's right.
There's only so much.
There's only so much,
we
right?
can do.
You can't be all things to all people.
Right.
I think organizations have to think about, in the realm of health equity, what is your unique lane in how to build health equity from the vantage point of who you serve and what your mission is, and what can only you do as a sector or as an organization, and be really good at practicing equity within the confines of that, because we don't have unlimited resources, right? We're in a system that is woefully flawed, and so it's what we can control. It's controlling the controllables and doing our best to be advocates and use our voice in our platform where we can't control things, but we can lend voice. I think is what's most important, and you all do that.
That's what we talk about, is that our job is to be the voice for those who don't have their voice or can't find their voice, or that we help them find it. But when that's not there, that we are that voice. And I do think it's important that we talk about what we do, which is around domestic violence. So we center our work around survivors and what's impacting them, and our work at the state level, at the federal level. We do a lot of policy work, like you had talked about, because there's so many policies that impact the survivors that we work with. And I think our work is never ending in that area. So I do think that that's something that we need to also hear, is focus on that. I often get so just like, oh my gosh, have I made a difference? Have I done anything? Because the problems often seem so large and so overwhelming. But if I can just think about, what is our role? What are we here for? This is our lane.
Absolutely.
It can maybe feel a little better, but often it feels overwhelming. Like there's always something that we have to address.
The work is undone.
Yeah.
I will say that for organizations who want to get serious about shaping health and racial equity, you have to be comfortable with discomfort. There's no way to address equity without levels of discomfort. You have to have a healthy level of risk tolerance. Mitigated, of course, always, but especially in our current climate, equity has become a bad word. There are a lot of organizations who were charging the hill for it in 2020 with the murder of George Floyd and Breonna Taylor and so many others, hundreds of others before them. And now we're seeing this dramatic shift, anti-DEI.
Even within
anti-equity.
universities.
Oh, in every system.
Yeah.
In every system. And it's being actively codified, right, in state policies and federal policies and along the way. It goes back to, how do we tool ourselves? because if it's not the word equity today, it'll be something else that gets banned
Indeed.
in 5 years.
Right.
In other words, we're not going to chase language here. We're going to educate, and we're going to help build narratives based in truth and help socialize narratives based in truth and justice. And we're going to focus on the immovable middle. And as organizations, I think you have to say, hey, where are we going to stand 10 toes down with mitigating risk factors so that our people who we serve don't lose. They're not continue to be harmed by our comfort, our fear. Right. That's the thing.
I listen to podcasts every morning and every evening on the way to and from work, and I was listening to a leadership podcast today, and I think you hit on all 5 of the points that I...
Well, she said that was one of her superpowers, right?
Leadership, yes.
It's leadership. I've learned to harness
things.
it organizationally, but I think the root of it, I was the only girl and the youngest of brothers. And so I think that's where my leadership skills were really birthed, and I'm all very serious about that.
You had a great model in your mother as well.
Absolutely. My mother and my grandmother, so many incredible women in my life. I'm so blessed to have just very strong, principled women who were connected to their own power, and that language wasn't used, but they embodied that and they demonstrated that.
Right.
That's really important to me. It's central in how I lead, is connecting individuals to their own power, finding those win-win solutions rooted in where and how people are most powerful in using their gifts and their talents and skills, and most importantly, how communities, how they tap into their power and how the power that exists there is amplified and recognized. Oftentimes we see our communities as vulnerable and at risk, and we stopped using that language at Health Forward because it's not helpful. And as nonprofit leaders, we've all grown up in the deficit-based language.
Absolutely. And we operate from that.
It's
so easy to fall into that.
We've all done it because in nonprofit, you have to describe the need, right? So you start with the destitute.
When they say who are the at-risk, I mean, those are words that they're using.
But that we shouldn't attach that to people. We have to define people by their strengths and their contributions and then describe their need. And so we've been practicing asset framing as a tool within equity. Language is a tool. It's important that we speak about the communities that we serve in a strengths-based, I'm a social worker, in a strengths-based way, in a way that describes their assets and describes the needs based on their conditions, not the people.
Right, because the people are resilient.
Right. That's right.
What you focus on, if we do try very hard to be a strengths-based, that's how we talk to our clients, and if you're doing that, if you're focusing on your strengths, then that's what gets the attention, and that's where your mind goes to being about how you feel about yourself as well. But if you're talking about all of the things that are weaknesses, then that's what you're focusing on.
I've learned so much today, I can't even tell you.
Oh, I was just going to say we could talk for hours and hours. This has been very wonderful, and I'm very grateful that you came and talked with us.
Thank you.
Is there anything else that you want to share before we close?
Well, thank you for the invitation. Thank you for having me here. I would just punctuate that equity is a practice, and we are in a very peculiar time in our country, and it's a time where equity-centered, principled leadership and love just needs to be centered and abound. And so encourage all of us who have platforms and positions of influence in our organizations at whatever level to think about what it means to practice equity. Consume the information, read up, tool yourself, and then unleash the power that you hold within it and the agency that you hold within it.
This entire podcast has been so empowering. I appreciate it so much and so appreciate you being here. We will make sure that your website is linked in with the podcast as well so they can find you.
Okay.
Appreciate you so much.
Thank you both.
Thank you.